Hello, everyone. Today I will be going over three topics: telehealth, HIPAA, and research practices. And we'll be starting with telehealth. So what is telehealth? Telehealth has become much more prevalent now, given all of the circumstances with transitioning things to online services. But in the past, telehealth wasn't really something that was done very much or spoken of very much. So telehealth involves using a telephone or internet video conferencing to provide mental health services, i.e. therapy. So basically holding a therapy session via phone or via video conference, like through Zoom or some dedicated platform that is meant for providing services. It was previously called telemedicine, but telehealth is more reflective of the mental health services that are being provided, as opposed to something that could be confused with medical treatment with the term telemedicine. So something that like a doctor would provide through telephone or video conference. So we use telehealth now. This term is reserved for therapy, as opposed to things like scheduling appointments or case consultations, which are normally done over the phone anyway, and would be more of like a coordination or a case collaboration kind of thing. So telehealth, providing therapy, mental health services over the phone or video. So there are a couple of things that we want to keep in mind when providing telehealth. First, the California Telemedicine Act. Remember I said it was previously called telemedicine. Basically, this law mandates that the client give verbal consent for telehealth services, and this consent is separate from what you would already do in an informed consent document. This separate consent form must be provided or documented in the treatment record. And essentially, the client is saying that they are in agreement to this form of service and that they understand the relevant risks associated with it. In terms of ethics, the APA Code of Ethics states that psychologists who offer online services inform clients of the risks to privacy and limits to confidentiality. So because you're providing therapy in a different platform, you're not in a private room, but you're on the internet or on the phone, more often on the internet, there are more risks to privacy and confidentiality. The internet connection may not be secure, as we've seen with folks kind of breaking into Zoom meetings. And so that's a risk. You never truly know how secure your platform is. And when a client is disclosing sensitive information, that's a big deal and something to be aware of. So we want to let them know that that is the case. AMPT, their code of ethics says that before you commence therapy through electronic means, you must ensure that you're compliant with all laws. And you do this first by determining whether or not electronic therapy is appropriate for this particular client. So if you have a client that's in crisis, that telehealth service may not be appropriate. They may need a more intensive face-to-face type of service. So you want to determine if this is going to be good for them. You want to, again, inform them of potential risks and benefits, educate them about different situations that might occur. So this would include like, what happens if the call drops? What is the protocol for that? What happens if they go into crisis in the middle of your session? What are you going to do? All of those things you kind of want to work through. You are to ensure the security of your communication medium. So because things transition in terms of mental health to telehealth really rapidly because of COVID, a lot of folks were using non-secure platforms like Zoom to provide therapy services. And we're really encouraged to use services that are dedicated to therapy that add an extra layer of security and encryption to help make these more secure sessions. So you should be using the best or the most up-to-date software you can to make sure that you're doing that. And then finally, you should only be using electronic therapy if you've been trained to do so. And that you're being supervised to do so. So if you've never done it before, you should do a class. There's a whole bunch of them, or go through it with your supervisor so that your supervisor can explain what to do, what not to do, and how to handle different situations. And this is, part of your scope of competence, right? Learning how to do this, expanding that scope. Okay, in addition to following through with the ethical codes and the laws, the BBS also has some requirements for telehealth. Note that some of these have been relaxed a little bit because of the circumstances, but in general, these are things you always want to do. And on an exam, you always want to select answers that are compliant with this. So first, provide clients with your registration or your license number and type. So at the beginning of this service, when you're doing the consent for for telehealth services, you want to explain to the client whether you're a trainee, an associate, a fully licensed person, and provide them with the license number if you're licensed or the registrant number if you're an associate. You also want to gather contact information that's relevant to this particular client, so resources that are local to this client to use in the event of a crisis or emergency situation. Since you can provide services all over California, if your client is in Northern California, for example, you may not be as familiar with the resources that are available, so you want to find out what they are so that you can provide them to your client if needed. Also, at the beginning of each session for telehealth, so each session, you must obtain and document the full name and current location of the client, meaning their specific address. And this is for emergency purposes. So it is possible that the client is somewhere else than they normally are, they're not at home or what have you. And so you want to know that so that if you need to send, like emergency services over to them, then you know where to send them. You also want to assess to make sure that this is still an appropriate medium for the clients as opposed to one-on-one. And you want to use best practices, I've already mentioned this, to ensure confidentiality and security of the communication platform. There are secure programs that can be used for telehealth specifically. Okay, we're now going to talk about telehealth across states, which often gets confusing for people, but there are rules. So licensure stops at the state line. You are only legally allowed to provide services, mental health services, to clients that are located within the state that you are licensed to practice in. So if you are licensed to practice in California, you can only provide services for clients that are in California. And the same is true if you're providing those services through telehealth. So providing services through telehealth to a client who's physically located in a different state is considered practicing outside of the state you're licensed in and is against the law. Now, of course, if you're licensed in multiple states, then that expands the number of states that you can provide services in. Note that the language that's used in this rule is physically located, not resides in. So that means that even if the client technically lives in California where you're licensed, but for some reason they're physically located outside of California, you still can't provide services for them. And we're going to kind of get into what that means in a little bit later. Okay, so only in California. Some states have specific regulations about telehealth and who can provide services. For example, Arizona, Colorado, Florida, and Wyoming provide short windows of time for online practice by out-of-state licensees under specific conditions. So this means that if your client is physically located in Arizona for a time being, and you are licensed in California, this state may allow you to provide telehealth services for a short time in certain circumstances, like they're moving, they're transitioning, they're in crisis, something like that. Note, however, that this very likely does not include registrants. This is for licensed folks, okay? And even in these cases, in these particular states, you still want to contact their board, the ones who manage MFTs, and make sure that it's okay. You don't want to break the law. California, on the other hand, tends to be really restrictive when it comes to licensing and mental health. So they do not allow out-of-state licensees to practice here, even for brief periods. So if you're not licensed in California, say for example, me, I was licensed in Washington, I couldn't provide services here in California physically or through telehealth until I was licensed here or until I was a registrant here. Okay, now what about clients that are transitioning? So If a client's traveling to a different state and wants to have telehealth, so let's say, for example, they're going on vacation for a few weeks, the California Licensing Board recommends that you check with the state they are going to see if this is allowed, okay? As I've already mentioned, some states allow it on a limited term basis. Some therapists may choose to continue seeing clients when they're moving out of state, okay? So someone who was seeing you in California, but now they're moving to Oregon, let's say, you may want to continue seeing them until they get services there. But if you're providing mental health services, again, you're providing actual therapy through telehealth, the same rules apply. So you need to check with the state and see if they will allow you to do that. This is different, though, than just checking in on progress or facilitating connection to a new therapist in the new state. So if you're calling them on the phone for like a 5-minute check-in and providing them with referrals or something like that, that's not considered therapy. Remember, those are more administrative, case collaboration, case consultation type of services, as opposed to providing a 50-minute session. And this is because actually providing therapy inherently involves much more risk because you're exchanging sensitive information and you don't know the resources or the laws in the state. So you're potentially placing your client at risk if they go into crisis because you wouldn't know what to do in that state and you're not there. Okay. Now, in the case of an emergency, again, your client's on vacation or they've moved and you hadn't planned to do telehealth, but there's an emergency, they're in crisis, and they are wanting to talk to us, you want to make an attempt to get permission from the state that they're in before providing services, or you can try to find out who the crisis line is in their state and provide that for them. It's just really risky to provide services without permission of the state since it's technically illegal. Okay, transitioning slightly to other forms of technology, other uses of technology outside of telehealth. Email. So email is regularly used between professionals at agencies, so therapist to therapist, therapist to supervisor, and so on. However, email correspondence with clients is a little bit more complex. So your agency will likely have policies telling you whether you can use email with clients or not. If for some reason they don't, and you're trying to figure out whether or not to use it, it can be helpful to consider what kind of information you plan to discuss over email. Okay? And then do the potential benefits outweigh the risks? For example, if you're scheduling appointments through email, that's not a huge risk because there isn't a lot of sensitive information being exchanged. It's still a potential risk because it could be a breach of confidentiality. If someone hacks your email, they now know all of your clients' names and when they come to see you, right? If you're providing mental health guidance over email, that of course is much more risky and is going to be strongly discouraged or just not permitted by many agencies. I think in general, agencies don't allow you to have email correspondence with your clients in general, but you can check and see. Okay. While there aren't any explicit laws or ethical codes about email correspondence, you can take information from ethical laws regarding providing alternative practices and treatment records and apply them to this case. So again, you definitely want to discuss risks and benefits with the client, as well as your security measures, so using encrypted services or secure email. You want to set boundaries with the client. When will you respond to emails? When will you not? Are you 24-hour available? Are you having emails pushed to your phone so as soon as they are received, you get them or not? You don't want, in my opinion, you don't want to give clients uninterrupted access to you by email. And you want to make that known, right? If they think that you are constantly checking your email and they decide, well, I'm suicidal, so I'm going to email my therapist. What if you turned off your phone that night? Or what if your phone died or something like that? And you don't get that email till the next day? Did your client potentially kill themselves because you didn't check your email? Who wants to be under that kind of pressure, right? And then it's also just nice to be able to step away from work when you're off. So consider those things. You also want to limit the type of information they send you via email and make that very clear for safety purposes. So my example there, things like suicide, homicide, abuse types of things should not be communicated via email, and you need to make that very clear. If those situations are arising, you need to call me or call the crisis line or whatever your policy is. Okay? Otherwise, you're exposing yourself to risk and it's your own fault. Okay? All right, another thing is text messaging, which of course has become very popular and are obviously very convenient for things like appointment scheduling. However, there are some important risks and limitations with text messaging, just as there are with email correspondence, that we need to be mindful of. Okay? First off, they're typically unsecured, which makes it hard to argue that they're in compliance with ethical guidelines regarding confidentiality. Okay? If you lose your phone, now someone has access to all of your client information, for example, or if someone hacks your phone, kind of the same thing. So that's problematic and something to be discussed. And again, just like we've already talked about, what are the things you're allowing clients to send you via text and not, and making those boundaries really clear. Also remember that electronic communication is supposed to be secured by double lock, okay? So whereas email, you can kind of be in compliance with that. You've got a password to get into your phone or computer and a password to get into your email. With text messaging, you don't have that. You probably have like a passcode on your phone and that's it. So that's not in compliance. And that means if the phone that you use for text messages is lost or stolen or hacked, that could be considered a data breach. And there are things you'll have to do in the event of a data breach. So it's best to keep text messaging to a minimum for more like administrative purposes, like appointment scheduling or appointment reminders, and to end it at that, and to let your clients know that that's what they're for, and that's it. Okay. Okay. Next topic, HIPAA. Okay. So I'll explain, before I go into that slide, I'll explain what HIPAA is. So HIPAA stands for the Health Insurance Portability and Accountability Act, Health Insurance Portability and Accountability Act of 1996. It was passed to promote standardization and efficacy in the healthcare industry and to give patients more rights and control over their health information and what is done with it. If you had to sum it up, I guess, it requires practitioners who are covered entities under HIPAA, and I'll explain what that is, to provide clients with a clear written explanation of how their health information is going to be used, disclosed, and kept. So what is a HIPAA covered entity? You or your agency are considered HIPAA covered entities if you or your agency transmit sensitive health information electronically for the purposes of billing, referrals, and so on. Sensitive information includes protected health information like client names, date of birth, diagnosis, and so on, as well as clinical information including treatment session dates, treatment goals, and so on. That's sensitive information. So if you are sending any of that information through electronic means like email or some other like note writing platform that's web-based or cloud-based, or you're submitting electronic invoices to an insurance company, any of that is considered transmitting sensitive information electronically and makes you or your agency a HIPAA covered entity. With this in mind, any provider or agency who works for the Department of Mental Health or who is DMH contracted or bills insurance would be considered a HIPAA covered entity, because insurance companies and DMH utilize electronic transactions through submission of notes or submission of invoices. Okay, so in most cases, you're going to be a HIPAA covered entity or your agency. What are the rules? The HIPAA privacy rule is the first one, and it requires technical, administrative, and physical safeguards to protect the security of protected health information in electronic form. So this includes things like those double locks that we've mentioned before, administrative safeguards like making sure that only certain people have access to paper charts, for example. Physical safeguards are the double locks. Technical safeguards are your passcodes and encryptions and things like that. We also protect health information by not disclosing confidential information outside of mandated reporting, legal mandates, or appropriate releases of information. The patient security rule says that client information is protected. Again, the double lock rule for records. Patient safety rule says that information used in reporting and analysis or assessment of safety events is confidential and privileged. And this is true for all clients. So this is talking about things like crises, abuse, and so on. That's all confidential, privileged information. And finally, the breach notifications rule. If there is any breach, like those data breaches I mentioned briefly, we or someone at our agency must notify the client, and there's a procedure for that. It's not listed on here, but this is something to very much be aware of and to remember. There's a strong likelihood that you'll get tested on this at some point in your careers. Also required for HIPAA, we are required to provide clients with a notice of privacy practices at the onset of therapy if we are HIPAA covered entities. Okay, and I'm going to repeat the name of that. You need to know the name of it. Notice of privacy practices. Okay, and you have to actually give them a copy of it at the beginning and have them sign indicating that they've received it. Okay, it should also be posted in your agency's office, or if you're a private practitioner, in your own office. And you must obtain written acknowledgement from them that they have received it. So that signature saying that they got it. Okay. Last topic, short one, ethical research practices. This is about conducting research with clinical clients. While you may never plan to do this in your career, you still need to be knowledgeable and aware of the relevant ethical codes for exam purposes. So you must, according to research ethics, you must take reasonable steps to prevent distortion of clinical or research findings when you are using clinical clients for research. Okay? So this means making sure that you don't make claims in your research findings that are inaccurate, or using them to kind of just further your own clinical career instead of using sound research practices. You also want to be sensitive to the possibility of diminished consent when participants are also getting clinical services, have some kind of mental health related impairment, or something of the sort that may limit their understanding in their participation, or when the participants are children. This basically means that we need to be even more intentional about providing and receiving informed consent, because the potential for exploitation is even higher. You're inherently dealing with a more vulnerable population when you work with mental health clients or with children. So you need to take extra steps and extra precautions to make sure that the client really understands what they're going to be doing as part of the study, what the risks and benefits are, before you do anything with them. Okay, yeah, so it's basically about consent. Okay, you also want to avoid dual relationships when doing research, such as having a current client that you're seeing for therapy also be your research participant, right? We just talked about the issues with dual relationships in terms of exploitation and so on previously, so the same kind of rules and reasons apply here. There's too high of a potential for exploitation. Your clinical client may feel obligated to participate in your research because they're your client, and they're not really being able to exercise their own autonomy in deciding whether or not to participate. They also may feel obligated to continue participating in the research study, even if it becomes uncomfortable, because they think they have to because they're your client, or they don't want to damage the relationship with you, or they feel bad that they're going to affect your research or whatever. And we don't want that. The client should always, the research participant should always have the ability to end their participation in research whenever they want to. Finally, it may negatively impact the clinical relationship if you were to have a current client also be a research participant. Perhaps they're going to be wondering if what they're telling you in session is going to end up in your published research, and so they may not want to be as open with you, right? And that's going to be detrimental and make the therapy relationship less effective. Outside of that, we want to also de-identify any data. And this is, so if you're doing it the correct way and not having current clients be your research participants, okay? So you have just your straight up research participants. You want to de-identify their data. And what this means is removing any identifiable information from their research data, like their names, date of birth, whatever, so that it's impossible for the readers of your published study to know who the data is about. This is especially important with clinical research, okay? It's already important with research that has nothing to do with mental health, but it's even more important in these cases because the information you're likely gathering as part of your study is much more sensitive. And finally, you want to give credit where it is due. And this means if anybody helped you in the research, like your supervisor helped you with it, for example, you want to acknowledge them or provide them authorship in your published paper. Okay, so that's it for these topics. We'll discuss further when we meet together, but let me know if you have any additional questions about these topics. Thanks.